Hi, it's Dr. Jenny here, and I want to talk today about hormone balance. This is a question I get a lot in the women that I see. And actually, many of them come to me because they are in that perimenopausal and menopausal phase, or they are experiencing a lot of menstrual dysfunction. They're not quite to the perimenopause phase, but they're seeing heavy menstrual bleeding, cramping, just really tremendous symptoms around that time of the month when they menstruate. And typically, the solution that's being offered to these women in the mainstream medical world is under 40 birth control pill, over 40 hormone replacement therapy. So I get the women who are doing those things. They don't necessarily want to be doing those, and they're still not feeling good because, of course, those things don't really address the underlying current of what's going on. They just sort of throw some hormone into the mix. And sometimes can that make you feel better in the short term? Sure, um, a little bit. But the big disadvantage of doing that long term is that both of those solutions carry an increased risk of estrogen-driven cancers like breast cancer, ovarian, uterine, things like that. So let's talk about, if you don't want to go that route, you don't want to be on some kind of oral contraceptive or device, like an implant device or a shot or a birth control pill, and you don't want hormone replacement therapy, even if it's bioidentical. I think a lot of people think, oh, it's bioidentical, it's better. If you don't want that, then what do you do? I think I always circle back to the fact that our hormones are meant to be in balance, right? Like, that's God's design for our bodies. It's not a disease. As we get close to menopause, that is supposed to be a natural process. Same thing with a monthly cycle. Those are healthy. They're supposed to be happening. It's not supposed to sideline us and render us useless, laying in a ball on the couch and bleeding for 3 weeks out of the month or 2 weeks out of the month. But those things are things that we have to balance. And so I think, so let's talk about, how do we get the body back in balance? The most common thing that I see is a situation where women are estrogen dominant, or they have an excess of estrogen. And I wrote an article. It's called Estrogen Dominance, not the kind of dominance that you want. So if you want to refer back to a blog or a podcast about that, I go into a lot of detail about that. And that, in my opinion, is because we are slathering ourselves full of smelly lotions and foundations and makeups and all kinds of stuff that has something called parabens in it. Those are very toxic to our hormone situation. So those kinds of things, they create, in a sense, a situation where your body feels like it has too much estrogen. So do things like drinking from those soft, squishy plastic water bottles, microwaving foods in plastics, things like that. So again, that's all, I talk about that a lot in that Estrogen Dominant article, so you can read that. But so we've got that side of the house. And then the other thing is the liver. So the liver is what helps clear, if you have too much of something that you shouldn't have, like estrogen, your liver starts to be really important in clearing it and breaking it down. And there are a number of reasons why that might not be happening as well as you could. You could be overloading your liver just because it's overwhelmed. Again, that's where all those toxic things like parabens and those little plug-ins that you plug in your house and they smell like flowers, and scented laundry detergent, dryer sheets that smell like, a field of roses or whatever. Those kinds of things, they overwhelm your liver. So do excessive cleaning products. Like, I feel like in the last couple of years, we're just bleaching everything. We're hand sanitizer wiping everything. And while I think it's good to be clean, I think all of those things come at a price if we're exposing ourselves to continual bleach and ammonia and cleaning fumes and So we're overloading and overworking our liver. Also, there is something called an MTHFR variant, and again, I have a whole article on that. You can look for MTHFR on my blog site, which is drjeni.com/blog, and read more about exactly what that looks like. But MTHFR variant, it slows down your ability to methylate, and when you don't methylate as well as you should because of a genetic issue which affects almost 50% of the population, so it's a big deal. These are the women that have a harder time clearing that estrogen. So we look at that as part of our picture of what do we need to balance on you. And I'm a huge fan of, if this is you and you need clarity around hormone balance, looking at things like either a Dutch test, which is a way to test your female hormones via urine, or using a saliva test to determine that. And it just depends on what a person tells me. I would pick the Dutch or the urine version or the saliva. I have some indications to connect someone with the best solution, because there are reasons why I would choose one over the other. But having your hormones tested right it is a great starting place, because sometimes people come to me and they have blood panels that have hormone markers on them, but what happens with blood is that the hormone is bound to the protein in blood, and you don't look at the levels of free hormone, or the levels that are actually doing something in the body. So it's best, if you're really trying to get a functional look at someone's hormone levels, of if they are what is available at the cell level, and that's a free hormone level, which is a urine or a saliva test is a much better choice. And then both of those tests, when I run those, I look at a stress panel in addition to that, because stress and the health of your adrenal system is very, very much tied to the hormones. That becomes especially important when you transition into menopause, because the adrenals start picking up the job of the ovaries. The ovaries are what secrete the form of estrogen that takes us through the cycling and childbearing years. But as we hit menopause, we have a different form of estrogen, and the adrenal glands are very important in that. So people that's adrenal systems are not healthy and they can't handle that extra load, those are the ones that menopause gets really bumpy for them. So just looking at things like that, looking at making sure your vitamin D levels are appropriate, that has a huge impact on your hormone health. Vitamin D is actually more like a hormone than it is a vitamin. So there's a lot of things that when you're trying to ask the question, how do I get my hormones balanced so that I feel good and look good and all that stuff, you can take one of two approaches. Like we said, you can take some kind of outside form of a hormone, whether it comes in a birth control pill or a cream, or something that you take, a hormone replacement therapy, whatever it might be. Or you can go, why is my body not doing this as it should? Is it the liver? Is it the adrenals? Is it am I missing some vitamin D? And evaluating that. And I feel like that is such a better approach, because it's actually dealing with the root cause. Taking hormones sometimes makes you feel better in the short term, but it's almost always long term not a recipe for feeling and looking your best. So anyway, I hope that you found that helpful, and you can reach out to me and leave a comment, or use my contact form on the website, or even click the button to schedule a free consult if you have an issue you want to talk to me specifically about in your personal case. Okay, thanks for watching.